Cures for anxiety. There are many people out there who say that they offer cures for anxiety. There are ebooks, books, CDs, DVDs, and all sorts of therapies, including psychotherapy and medications. But do these offer true cures for anxiety disorders, like panic attacks and OCD and phobias and agoraphobia and PTSD? Well, in over 12 years of practice and a vast amount of experience through myself and my psychologists and counsellors, we've never come across anybody who has said that they've had a curative effect from those kinds of therapies in isolation. So that leads us to believe that the majority of these things can offer some support, advice, information, but few of them lead to a complete cure. In order to overcome anxiety disorders completely, it is absolutely vital that the therapy used addresses the subconscious anxious behaviours that cause and perpetuate anxiety. What do I mean by this? Well, you've developed your anxiety disorder for one reason. There is only one cause of anxiety disorders. Forget about all of the anxious catalysts in your life that were the catalysts for the initial high anxiety. There is only one internal mechanism that causes anxiety in every single person. And that's appropriate anxiety and inappropriate anxiety that causes anxiety disorders. This mechanism is the anxiety control centre in the subconscious mind, and it's called the amygdala. The amygdala is actually a pair of organs in the brain, and they act rather like an anxiety thermostat. They control your level of anxiety. But how do they do this? Well, it's very simple. The sensory organs, your eyes, your ears, your nose, your mouth and your skin, feed back data from your environment. So when something happens, maybe you're attacked by a dog, for example, and it's barking at you and growling, your eyes and your ears and your nose and your mouth and your skin feed back data about that particular fear or anxious stimulus, I like to call it, and feeds back to your subconscious mind. Your subconscious mind, the amygdala, then makes some decisions based on basically doing risk assessments. And this is done by sending out questions. These are what you'd commonly call what-if questions, and they're the same questions that cause people to ask things like, what if I died? What if I lost consciousness? What if I had a panic attack here? What if I did X to my sons or my daughter? Or what if I did X to my wife? Or what if I picked up that knife? Or what if I jumped through that window or jumped off that cliff? What-if questions can be very powerful and then meant to do risk assessments of your environment so that your amygdala can make decisions about how to react when a real threat is present. But in anxiety disorders, no real threat is present. So what you must understand that what you're experiencing isn't real threat at all. It isn't real anxiety. It's the sensation of anxiety. It's false fear. So a therapy that works, a device that cures you of your anxiety, must address this, because this is the only way to cure an anxiety disorder. Medication and talking therapies don't reach the part of the brain responsible for the anxiety response. They're not targeted enough, they're not powerful enough, they're quite superficial. And medication is completely misguided in the cure of anxiety disorders, because it isn't something that it needs. The anxious reaction is behavioural. It happens in your subconscious mind. It doesn't happen as a result of injury or of any chemical imbalances that require correction through medicinal therapies, taking drugs. Anxiety disorders can be combated and overcome very, very quickly indeed. In fact, our clients usually experience that anxiety disorders are cured in days. And the reason that happens is because once you address the subconscious anxious reactions in the amygdala that are responsible for the anxiety, it can't help but be switched back down to your birth preset of anxiety. In other words, the level of anxiety that you experienced on day one of your life, your preset. Appropriate anxiety levels that are waiting to be sparked into action when something real is there for you to be frightened of. The Linden Method program does exactly this. It creates an environment for change. It creates an environment where your sensory organs feed back to your subconscious anxiety control centre, the amygdala, data that forces it to believe that it's safe. And once this happens, the amygdala switches itself back down to a normal, appropriate level of anxiety, and you are cured. Your anxiety isn't being managed. You're not learning coping strategies, you're not taking drugs or doing long-winded therapy. In a very short time indeed, you can switch off that inappropriate anxiety and be cured. I've done it, and tens of thousands of my clients have done it from around the world over the last 12 years. We have many, many referrals from psychologists, doctors, psychiatrists, mental health practitioners and health organisations because they've seen exactly what it is that we do to cure their clients, and so they keep sending us clients because we do what they don't manage to do. I hope you give us the opportunity to do the same for you, and I look forward to welcoming you onto the Linden Method programme.